Thank you both for such a spirited and lively discussion. I'm going to turn it back to Priya now so we can hear what questions other people have.
Thank you, Julie. I think that was an amazing discussion. Dr. Campbell and Dr. Daniel, we have a list of questions sent in from our listeners. I am seeing that we have covered quite a bit of the questions in our discussion so far. So I will quickly go over some of the questions. Our first question is for Dr. Campbell. The listener asks, dairy may negatively impact prostate cancer. Do you know if calcium from plants and other non-dairy products need to be tracked when counting the daily 1,200 milligrams of calcium?
I think there's two questions, one having to do with prostate cancer and one having to do with calcium intake. If the questioner is discussing this in the context of the effect of calcium on prostate cancer, yes, it turns out that the higher the consumption of dairy, the higher the risk of prostate cancer. But that's not necessarily just because of the calcium. The evidence tends to suggest it's the protein in the milk itself. In fact, our own work conducted over a period of 27 years with public money, we demonstrated multiple times over that the most significant chemical carcinogen we consume is the protein in cow's milk. So what people have been now observing, higher prostate cancer, higher dairy. The same as higher dairy, higher osteoporosis as well. But it's not just with respect to calcium.
Thank you, Dr. Campbell. Dr. Daniel, the next question is for you. Our listener asks, your book, Nourishing Broth, talks about the health benefits of old-fashioned bone broth. Why does broth have the power to heal? And have scientists identified the key healing components?
There have been very, very few studies on broth itself, and one of the reasons for that is there's no profit motive there. But we have many, many studies on components in broth. From the 19th century and early 20th century, many, many studies on gelatin, the collagen component of broth. So there's those studies, and then more recent studies on individual components such as glutamine, glucosamine, chondroitin, the amino acids proline and glycine, which are essential for joint health and actually overall health. Every part of our body needs good proline and glycine, and also glutamine. So we have many, many studies on the components of broth. So that doesn't tell us exactly how much broth or exactly what ingredients should go into the broth when we make it, but I definitely recommend homemade broth with plenty of bones and cartilage and collagen. So it's one way we do nose-to-tail eating. It's what Mother Nature provided for us.
Thank you, Doctor. Dr. Campbell, the next question is for you. What do you recommend as a sugar substitute for people who cannot eat sugar due to diabetic complications? Stevia, xylitol, erythritol, which of the artificial sweeteners are the same?
I recommend none. In fact, what I recommend is to try with a little willpower, just get away from the consumption of sugar itself, and it's possible. It's quite easy to do. It may be a little more difficult for some than others, but I don't recommend any sugar substitutes, just the same as not recommending any sugar itself.
Thank you, Doctor. Dr. Daniel, this question is for you. The person writing in is a nutritionist and says most vegetable oils, canola oil, and even olive oil are processed and refined. These oils have been bleached, deodorized, had chemicals added to increase their fry life. Knowing this, how can we as dietitians recommend these oils as healthy alternatives to butter, ghee, and other cooking fats?
Having trouble hearing the question. I gather it's about butter and good old-fashioned fats that I would recommend, like butter and coconut oil, as opposed to industrially processed vegetable oils, which are a known health hazard for any number of reasons. So I recommend going back to what our ancestors did and getting our vegetable fats in the vegetables themselves.
Thank you, Doctor. The next question is also for you, Dr. Daniel. For years, we've been told eating red meat is bad for us, and we should only eat it once a week or less. Is that true if you're eating high-quality grass-fed meat?
I think some people benefit from red meat every day. That's not a typical person, and many people, maybe it's once a week. I always do recommend a rich and varied diet, including types of meats. When people are avoiding red meat, they tend to start moving into other things like perhaps too much fish from contaminated oceans, perhaps too much of the wrong kind of poultry, or worse, some of these plant proteins such as hemp protein and soy protein and pea protein and substitutes, Father Technologies proteins.
Thank you, Dr. Daniel. Dr. Campbell, the next question is, the U.S. government recently changed its stance on cholesterol, saying that it is not a nutrient of concern for overconsumption. Can you please comment on this?
Yeah, I missed your first part of your statement. What was it you're talking about?
The U.S. government recently changed its stance on cholesterol. And it said that cholesterol is not a nutrient of concern for overconsumption.
Yeah, I agree with that recommendation of the U.S. Dietary Guidelines Committee. I know that kind of worked quite well. We have for too long relied on the idea that cholesterol itself causes heart disease, or cholesterol in the food is related to the cholesterol in the blood, when in reality we've known for more than 100 years it's not the cholesterol, it's the animal protein that does that. And there were really some brilliant studies done but ignored showing that when cholesterol was compared with animal protein in terms of its ability to increase cholesterol in the blood and subsequently to develop atherogenesis, that's the early stage of heart disease, it's the animal protein that does that. It's not the cholesterol. So I've always been troubled with the idea that we focus too much on cholesterol. It's a reductionist idea. It's of context. But by the same token, when we have cholesterol in the food, then we're consuming animal-based foods. So cholesterol turns out to be a marker of the kind of food we're eating. It's not related to the cholesterol causing the disease. We need to clarify that relationship.
Thank you, Dr. Campbell. We are almost to the end of our hour now. That was a wonderful, great, I would say very enlightening discussion. Dr. Campbell and Dr. Daniel, it was an honor to have you here with us and a pleasure to listen to you. Julie, you are wonderful. Thank you so much. The recorded broadcast will be available on CureTalks website along with the transcript. Please visit CureTalks.com for upcoming shows. Thank you, everyone.
Thank you. Thank you, Priya. Thank you, Dr.
Thank
Campbell
you so
and Dr.
much.
Daniel.
Thank you, Dr. Daniels.
Thank you. Bye-bye.
Bye-bye.
Bye-bye.